Do you have chronic pain and are watching this video? Then you've probably already been underestimated. Unlike blood pressure, where a patient with hypertension puts a device on their arm and someone looks at a number that tells if their pressure is really high and believes what they're experiencing, you don't have a test. You don't have a device that measures the pain you're feeling right now. And then, when you meet a specialist who doesn't understand the subject, they will underestimate your pain, as if you really weren't feeling what you're feeling. It's very sad, because you're suffering, you need help, and the person who could help you doesn't believe what you're saying you're feeling. This happens because pain is something the brain interprets. It's something the brain makes you feel. It's not just in your head. Actually, it is in your head, because it's your brain that makes you feel it, but it's not something you control. It is a disease, it exists, and it needs to be treated. However, we have no way to quantify it. There are some tests that can be done to show, for example, an injury to a nerve, an injury to the spine, an injury to the knee or a tendon, which cause this pain to start, to appear, and to remain there. But from that point on, the pain cannot be quantified. In fact, here's an important piece of information for you. The diagnosis of some types of pain, for example, complex regional pain, is clinical. We do it by asking the patient questions, filling out a scale, and then we determine whether or not you actually have the problem. So it is not necessary to have a test that shows complex regional pain or that quantifies your pain. The diagnosis is made through questions. Therefore, if the doctor talking to you couldn't find your pain in an exam, he's probably looking in the wrong place and doesn't understand your problem. Just because it doesn't show up in an exam doesn't mean you don't need treatment. You need treatment. You need to believe in your pain. And you need a specialist who also believes in your pain so that together you can find the best solution for it. I want you to share your experience with other patients and with me down below. Comment your story and what you've heard from specialists who told you there was nothing wrong with you and what you did to resolve this situation. If you liked this video, like it and follow our channel.